Natrum Muriaticum Part 2. Particular headache. Causation: exposure to sun, eye strain, taking too much salt, and loss of vital fluid. Location: left-sided clavus. Sensation: as if 1,000 little hammers are knocking on the brain. Character of the pain: bursting type of headache, which is chronic in nature. Headache start with blindness, zigzag vision. Such type of headache is usually found in school-going girls who are emaciated, anemic, and chlorotic. Modality: aggravation from heat of sunrise to sunset, especially from 10 to 11 am. Amelioration occur relieved by perspiration and open air. Concomitant: blindness before headache, patient having an anemic and chlorotic look, mapped tongue and great craving for the salt. Respiratory organs: nose, violent and fluent coryza with breathing difficulty. Stoppage of nose, discharge is thin and watery, like the white of an egg. Violent sneezing, loss of smell and taste. Cough: Natrum Muriaticum is especially indicated in marked coryza and cough. Sensation: sticking sensation in the throat. Character of sputa: sputa is thick, whitish, watery like the white of an egg. Modality: aggravation, more in the morning and on the seashore. Concomitant: inability to swallow. Whenever he coughed, tears streamed down the face. Mapped tongue with red insular patches. Loss of taste in the mouth. Heart symptoms: fluttering sensation of the heart, weak faint feeling, the heart's pulsation shake the whole body. Modality: aggravation from lying down and at the seashore. Amelioration by lying on right side. Urinary symptoms: slow action of the bladder, urine comes slowly, dribble out, lack of force in the flow of urine. Involuntary urination, especially when walking, coughing, laughing. Patient cannot pass urine in the presence of other, has to wait for a long time before passing urine. Cutting pain in urethra after urination. Sensation as if more urine has remained. Frequent urging for urination. Must pass urine very often. Menses: first menstruation at puberty delayed. Time: too early. Duration: irregular menses which may be of various types, that is too early to too late, too scanty or too profuse. Concomitant: bearing down pain which is worse in morning, hot feeling during menses, headache after menses, sterility with too early and too profuse menstruation. Anemia. Causation: loss of vital fluid. It causes alteration in blood and hence produces anemia. Cachetic condition and chlorotic look. Blue rings around the eye and edema with other generalities of the drug. Skin symptoms shows eczema. Location especially on the margin of hair, scalp, behind the ears. Look raw, red, inflamed and ulcerated. Modality: aggravation from eating too much salt at seashore, etc. Amelioration in open air and by cold bathing. Urticaria: acute or chronic over whole body, especially after violent exercise. Herpes: herpetic eruption, especially around the edge of the hair and nape of the neck. Warts on palm of the hand. Fever blister: blister at the side of mouth in intermittent fever, like small pearl about the lip, with lip dry, sore, cracked and ulcerated. Nail: hangnail skin around the nails, dry and cracked. Fever: Natrum Muriaticum is a medicine which should be thought of especially in chronic intermittent fever. The symptoms are as follows. Causation: abuse of quinine, old, chronic, badly treated and neglected case of fever. Character: periodicity well marked. Chill returns in the morning, especially at 10 to 11 am. Fever with severe headache. Left-sided clavus as if 1,000 little hammers were knocking in the brain with coldness of the body and chilliness well marked. Modality: sweat on every little exertion with relief of all the suffering. Concomitant: fever blister, especially at the corner of mouth. Map tongue with red insular patches. Baby: look of the baby pale, anemic, weak, and emaciated. Emaciation especially marked in the neck with long neck. There is descending type of marasmus. Baby loses flesh while living well. Relation with heat and cold. Hot baby: 8. The child has great liability to catch cold with frequent sneezing and watering of nose. Modality: the baby is very much cross, irritable even when kindly spoke to. Cries from the slightest cause. The child gets into passion about trifle, especially when consoled. Consolation aggravates all the trouble. Desire and aversion. Baby has intense craving for salt and child has great aversion to bread. Tongue: the baby is having mapped tongue, slow in learning to talk with heavy and difficult speech. Stool: usually constipated. Urine: there is involuntary urination while coughing, sneezing and laughing. Modality: aggravation from taking excessive salt and heat of the sun. Amelioration: ongoing without regular meal and open air. General modality: aggravation from sunrise to sunset, especially from 10 to 11 am at seashore, from sea air, heat of sun, mental exertion, lying down, and by consolation. Amelioration in open air, cold bathing, going without regular meal, lying on side, right side.